The Earlswood Asylum was the first purpose-built institution for intellectually disabled children in the English-speaking world. Started in the 1840s within a small number of homes in London, the charity behind the initiative grew quickly, constructing an impressive new asylum on Earlswood Commons near Redhill. Although built at the same time as many of the famous county and borough lunatic asylums of the mid-Victorian era, the Earlswood Asylum was unique in two key aspects. First, it was constructed by a charity, rather than the county pauper lunatic asylums, which were administered by county magistrates. And secondly, it was intended for children and adolescents with permanent intellectual disabilities. In the years before the National Health Service, the asylum functioned as a subscription hospital, meaning that benefactors contributed donations to the hospital on a yearly basis. Fundraising and festivities and subscription drives were an important part of the annual calendar. Most of the children admitted to this hybridized institution, one that represented itself both as a residential special school and as a mental hospital, arrived from poor families and did not pay any hospital fees. Over time, and in response to demand, the Earlswood Asylum accepted a limited number of fee-paying patients from wealthier families, using this revenue to help subsidize the charitable cases. Children admitted to the institution, which grew to an inpatient capacity of over 500, came from across England and Wales and were supposed to stay for a period of 5 years. In practice, however, the length of stay varied considerably. Some children returned to their families after this 5-year period, but others ended up staying for their entire lives. During their time at Earlswood, the patients were assigned to pedagogical and vocational classes in order to learn basic literacy, self-help, and life skills. Legally speaking, the Earlswood Asylum was classified as a mental hospital under the Lunatics and Asylums Acts of 1845. As a consequence, the law determined that the asylum had to be administered by a medical practitioner and abide by comprehensive regulations regarding record keeping and medical admission of institutions caring for the quote-unquote insane. Thus, Earlswood, like the Victorian county lunatic asylums, was required to keep and present to inspectors medical and administrative records, most of which have survived in the Earlswood collection of the Surrey History Centre. The collection remains one of the most impressive in all of Britain, with an extraordinary array of casebooks, financial ledgers, admission registers, staff wage books, lists of charitable subscribers, as well as small caches of personal letters between family members and their children. Of particular note are the records associated with Earlswood's second superintendent, Dr John Langdon Down. While medical superintendent between 1858 and 1868, Down mastered the technique of glass plate photography, which he used to capture many of his residents who had been admitted to this imposing Victorian building. A large collection of his photographs date from the mid-1860s, the time when Down was formulating his famous ethnic or racial classification of intellectual disability. It was near the end of his tenure at Earlswood that Down published a speculative medical paper that would popularize the classification of Mongolism, a term which would be used in medical and lay circles for almost a century. Eventually, with the genetic discovery of trisomy 21 in the late 1950s, the condition would be renamed after Down as Down syndrome. When the doors of the Surrey History Centre reopen, I would invite you to peruse through this fascinating collection of records. Thank you.